This has been like the one that I really got no kind of like guidance on was with doctor visits and choosing the right doctor being pregnant. So of course I looked up the in-network providers for through my insurance, and I checked to see like who is in network. If you have an in-network provider for through your insurance company, that means that you're not paying as much as you would if it's an out-of-network provider. Of course, you have your deductible you have to meet, and then the whatever the terms are for your insurance policy, but you want to go with the in-network provider. So I looked that up first to see like what doctors were in my area closest to me, because I preferred to go to a doctor that was nearby, because I live in Atlanta and traffic is crazy. Not everybody has health insurance. How do you deal with pregnancy without health insurance? Definitely, as soon as you find out you're pregnant, you want to be taken care of and have some kind of healthcare plan in place. So if you don't have insurance accessible to you through your job or through your partner's job, definitely apply to your local Medicaid. I think you can apply online. I know for Georgia you can apply online, but maybe you have to apply in person in your state. But definitely that's like A1 priority, because these bills, these doctor visits, they cost, they add up. I know for me, every ultrasound that I have, it's an out-of-pocket, fee. My insurance company covers some of it, but I cover a lot of it as well. And then the prenatal visits are, global coverage. So anytime it's just a regular checkup, that's 100% covered by my insurance company. But if you don't have insurance, that can add up. These doctor visits are hella expensive. Even with my insurance, I didn't know, like, okay, I have to meet my deductible before I can get everything like taken care of at 100% with my prenatal visits, or that ultrasounds were an out-of-pocket cost for me, that my insurance company only covered 80% of that and 20% was my obligation. Things like that. Like, finances become a big thing when it comes to your doctor's visits and your prenatal checkups and all this stuff. So especially if you're a high-risk pregnancy, you're going to have more frequent doctor's visits. So you really want to make sure that your insurance is in place. And if you're a low-risk pregnancy, you still want to make sure that you have your insurance in place so that they're taking care of most of your costs for doctor's visits and everything. From the first time that you go to the doctors, when you first find out that you're pregnant, till the end, you're going like every month. So when I first had my first doctor's visit, I was 8 weeks already, because they don't see you until you're at 8 weeks from the first day of your last menstrual cycle. So my first visit was at 8 weeks, and then my next visit was 12 weeks, 16 weeks, 20 weeks, 24 weeks, 28 weeks. From 28 weeks, they want to see you every 2 weeks until you're 36 weeks, and then it's every week until you're 40 weeks and you're delivering. So that's a lot of visits, a lot of doctor's visits, a lot of checkups, and that stuff can add up. So saying all that to say that health insurance is super important. So if you don't have insurance through from your job or your partner's job, you can apply, for Medicare and have hopefully your state be able to provide some of that relief of healthcare support that you may need while you're going through prenatal care, but also post-delivery, because the baby's going to need insurance and need to be protected and looked over, and the pediatricians are going to need to see them, and you're going to want to make sure that you have some insurance to cover that, because the bills will add up. So just that's something to take into consideration when you do find out that you are pregnant. Make sure your insurance is taken care of, and then also make sure you know the details of what your insurance covers and provides up front. Like, call them, ask them what's your deductible for your medical, for your hospital, your out-of-pocket, and then also how much they cover versus how much you're obligated to cover, because you don't want any surprises. The bills are gonna come and you're gonna be like, what in the slam ham? Why am I paying when I paid? If your doctor office is asking for money up front, like if it's like they want a copay or they need you to pay for ultrasound or whatever up front, double check with your insurance company to make sure that that's what's supposed to happen. And even if you have to wait a little while, get your doctor to be on the phone with your insurance company to make sure everybody's on the same page. Do that, because the medical industry is an industry and everybody gotta eat, you know, but this is also your money, so you want to make sure that you're being taken care of as properly as possible.